iGlaucoma presents a video series.
This is Larissa Camejo, and I'm going to show you a video of the OMNI Ergo. OMNI Ergo is the latest version of the OMNI Surgical System. One of the improvements over prior versions is the tip of the cannula. It is of a more triangular shape. The opening of the tip is of shorter distance, and the closed curvature is slightly longer. It seems to guide the microcatheter in a better and more stable way into the canal of Schlemm's. Like in any MIGS procedure, visualization is everything. You want to have a clear view of the angle structures, and the positioning of the OMNI tip is going to be critical as well. You want to point that tip about 15 degrees up. You want to point it towards the posterior trabecular meshwork to gain entrance into the canal of Schlemm's. And I would say towards the anterior end of that posterior trabecular meshwork, always a little bit higher, a little bit more anterior than what you want to be. I find that that is usually the case for almost any angle-based canal procedure. Once you have the correct positioning, you advance the wheel, which advances the microcatheter into the canal of Schlemm's. That material is nylon 12, and it's of that blue color that makes it easy to be visualized in the canal of Schlemm's. It cannulates it for a whole 180 degrees, and once it reaches a stop, you're going to retract it, and that way it delivers a viscoelastic into the canal of Schlemm's, viscodilating it as well as the distal collector channels. Then we remove the OMNI Ergo and we turn it 180 degrees and we reintroduce it into the eye. You position once again the tip just as discussed before, and this time you're going to introduce the microcatheter into the other half of the canal of Schlemm's, completely cannulating the 180 degrees, and you're going to retract it to perform viscodilation and advance once again if you want to perform an ab internal trabeculotomy or goniotomy. If you do want to do that, what you do is you retract the OMNI Ergo from the eye with the catheter inside the canal of Schlemm's, and it is advisable to follow the curvature of the eye as you are retracting the OMNI device. One of the advantages of the OMNI surgical system is that you can tailor it to your patient's needs. In other words, you could perform 360 degrees of viscodilation and 180 degrees of ab internal trabeculotomy, or you can expand or decrease the amount of ab internal trabeculotomy that you decide to perform in each given patient. I hope you like the video. Thank you very much for watching.
Want help with postoperative MIGS management? Check out my 2 free guides. The first is a step-by-step treatment roadmap for routine MIGS cases, strategies that can be applied to several MIGS techniques. The second is a patient case vignette series. This helps you handle common postoperative challenges when the cases are not straightforward and how to manage them. Get access now in the description box below.